cancer is known to medical science since thousands of years. The first revolution in cancer occurred around Second World War when chemotherapy was investigated and it was used for treatment of cancer. Subsequently, in 1980s, targeted therapy came, where a specific antigen was identified on cancer cells and these cells were targeted with these medicines. Targeted therapy does not have side effects like chemotherapy. Chemotherapy acts on both normal and cancer cells. However, targeted therapy selectively targets cancer cells. In spite of all these treatments, the number of cancer patients and incidence of cancer in the community is largely growing across the world. Now, subsequently, with further development of immunotherapy, those patients where cancer was untreatable by chemotherapy and targeted therapy also can be treated even in advanced stages of cancer. However, in spite of all these treatments, in patients with cancer, we always tell them that you are in remission after the treatment. What that means? At the time when I have seen the patient, there is undetectable disease. However, we are not able to tell patients that cancer is cured. However, this scenario is changing. Our view towards treatment of cancer from remission is now changing towards cure, particularly in patients with blood and bone marrow cancers. So there are two major advances that happened in the last 50 years and one major advance that happened in the last 4 to 5 years, which is leading to cure in patients with blood and bone marrow cancer. First is bone marrow transplant. Allogenic bone marrow transplant is the only curative treatment for patients with blood cancer and bone marrow cancers. So patients with blood cancer which is refractory to chemotherapy and immunotherapy, in such circumstances, a normal healthy donor stem cells are transplanted in patients' blood after giving them chemotherapy. This leads to immunity against the cancer and these patients do not get cancer back, and hence it is considered as a curative treatment for blood and bone marrow cancer. Chimeric antigen receptor therapy is innovated in the last 4 to 5 years, where T cells, which are immune cells against cancer, are extracted from patients. They are genetically modified into the lab to give them capacity to fight against cancer and injected again in the patient's blood. These cells then expand themselves, and every time there is a new cancer cell develops, it kills that cell. Hence, it leads to cure for cancer patients, particularly blood and bone marrow cancers, for years and years. So with the use of immunotherapy, targeted therapy, bone marrow transplant and chimeric antigen receptor therapy, we can now say that patients who used to say you are in remission, we can tell them we have a movement towards cure for cancer very shortly.